ADA and the European Association for the Study of Diabetes have been collaborating since 2006 on these joint consensus statements about hyperglycemia management. They're generally come out every 3 years, and what's different this time is more of a focus on healthcare systems and social determinants of health as really the path forward towards better implementation of what we know works to manage hyperglycemia and reduce complications in people with diabetes. And the second major difference is a focus on 4 sort of major pillars to diabetes care: managing glycemia, managing weight as an equal target, cardiovascular risk factor management, and then cardiorenal organ protection.
In my practice, I see many people with type 2 diabetes and obesity, even severe obesity. And what I used to do is to prescribe a very low-calorie diet for 1 month in order to reduce body weight, and then following with a low-calorie diet in association with GLP-1 receptor agonists in order to reduce appetite. The use of GLP-1 receptor agonist, possibly in association with the SGLT2 inhibitors, allows the people with type 2 diabetes and obesity to obtain a good metabolic control.
What we now propose is to be much more proactive. And for instance, for glucose control, to already start thinking of combination therapies from the diagnosis, from the beginning. Healthy lifestyle behavior, metformin, cardiorenal protective agents, and even other interventions aimed at glucose or weight management, so that you have tight control, multifactorial tight control from the beginning. And what we also acknowledge is that the person living with type 2 diabetes is an integral part of the team. He or she is at the center, and it's really nothing about them without their own voice. So they are really at the center of care. You need to have individualized approaches, and indeed social determinants of health are very important there.
There are a number of practical tips for clinicians in this consensus report. For example, one of the practical tips is the individualization of care, that we need to consider each person living with type 2 diabetes as an individual with specific needs, with specific risks, with specific preferences and context, which is very important. Also, the diabetes self-management and education support, this is as important as pharmacotherapy. Sometimes we think of pharmacotherapy as the most important component in the management of type 2 diabetes, but healthy behaviors, medical nutrition therapy, physical behaviors, even sleep, which I already mentioned, appear to be as important as the pharmacotherapy in type 2 diabetes.